Hello, everyone. Thank you so much for joining us. We're really excited that you've tuned in with us today for our third seminar series episode. I guess we'll get started by telling you a little bit about ourselves. My name is Judah Lawa. I graduated from Yale University last May with a degree in global affairs and molecular, cellular, and developmental biology. And I'm currently a graduate student at the University of Cambridge studying public health with ASHRI. Most of my past work and experience is in the humanitarian sphere, working with refugees and displaced populations to improve access to health services. ASHRI, Yael, and I, and Andrew, are just a few members of a new organization called the COVID-19 Task Force on Domestic Violence. Given the recent COVID-19 outbreak and social control measures that have been put in place, survivors of domestic violence are facing unprecedented challenges. And our organization tries to address those challenges and support survivors from a number of vantage points. Our goals are threefold. One, the consolidation and provision of concrete data to inform and articulate effective policy. Two, to educate the public on this important issue and to offer opportunities to get involved in supporting survivors. And lastly, to advocate on the behalf of survivors in any way we can. This seminar series is just a small component of our education efforts, and you can learn more about us and our efforts on Instagram at COVID-19_taskforcedv, our Facebook at StopDVCovid-19, or our website www.covid19taskforcedv.org. Thank you so much, and I'll pass it off to Yael.
Thank you. Hi, everyone, and thank you for joining this call. My name is Yael Danieli, and I graduated from Harvard in 2019 with a degree in psychology and global health. I've worked alongside ASHRI on a gender-based violence program in Kisumu, Kenya, and I'm currently pursuing a master's in science at the Institute of Human Nutrition at Columbia University.
Thanks, Yael. Hi, everyone. My name's ASHRI. I graduated last year from Harvard with Yael, studying economics and global health, and I'm currently doing a master's in public health at Cambridge University with Jude. Most of my work in the past has been on sexual violence prevention in Kisumu with Yael, and I'm super excited today to invite guests from all across the country and world who have worked both internationally and nationally on this issue to advise us on their experience with COVID-19. Across the world, we've seen with the lockdown measures an increase in domestic violence, looking at child abuse, intimate partner violence, and elderly abuse. And so it's really interesting to think about what's common between what's occurring across the world, and also if there are some universal prevention strategies that are effective across contexts. So thank you so much again for being here today.
So now I'd like to start off by introducing our guests, Dr. Yael Danieli, Ms. Maro Matosian, and Professor Sommer. Dr. Yael Danieli is a clinical psychologist in a private practice, a victimologist, traumatologist, and the director of the Group Project for Holocaust Survivors and Their Children, which she co-founded in 1975 in the New York City area. Additionally, she is the founder and director of the International Center for Multigenerational Legacies of Trauma. She created the Danieli Inventory for Multigenerational Legacies of Trauma that would allow for international study of phenomenon through a scientific tool. She has authored 6 books on subjects ranging human rights, terror, trauma, and has done extensive psychotherapeutic work with survivors and children of survivors on individual, family, group, and community basis. Dr. Danieli has led projects and served as a consultant for the International Criminal Court, South Africa's Truth and Reconciliation Commission, the UN Crime Prevention and Criminal Justice Branch, the World Health Organization, the FBI, UNICEF, and many other institutions and organizations throughout her career.
And I have the distinct pleasure of introducing Ms. Maro Matosian. Ms. Maro Matosian is the founder and executive director of the Women's Support Center of Yerevan. Ms. Matosian and many Boston area Armenians came together to create this center to help combat rising levels of domestic violence that they were seeing in Armenia. The organization has had great success in helping women. The center was once described as a small experiment, but has now turned into one of the best run women's service providers in Armenia today, especially in regard to domestic violence. We're really excited that you joined us today, Ms. Matosian.
Thanks so much, Jude. We're so excited to have our guests. And last but definitely not least, we have Professor Doris Sommer, who is an Ira and Jewel Williams Professor of Romance Languages and Literatures of African and African American Studies. She's also the founder of Cultural Agents, which is a Harvard initiative and an NGO dedicated to reviving the civic mission of the humanities. And finally, she has written and published several books, including Cultural Agencies in America and the Work of Art in the World, Civic Agency in Public Humanities, which aim to promote development through arts and humanities. Thank you all so much for being here today. We're very excited to have you and learn from you all.
Okay, so we wanted to start off this conversation by asking Dr. Danieli, given your dedication to supporting survivors, what do you think are the unique challenges for those who are experiencing violence at home during this time of lockdown?
If you mean challenges now as compared with normal challenges that they face, normal, that means pre-COVID-19, the shelter in place, as you know, closes the doors for victim survivors. I don't just call them survivors because they're victimized as well. For victim survivors to use external supports that they may or may not have regularly, such as shelters for women, calling trusting police, such as schools for children, such as even stores that can identify signs of indicators of abuse in either in women or in children or in men for that matter. I think and not only does it deprive the potential and actual victim survivors of external support, and I didn't even mention institutions such as the clergy, etc. We can talk about the various external actors later. But internally, they are confined together. Men, husbands, fathers, often now out of work, feel inadequate and powerless, and they lack their means of, again, normal means of energy, anger, work, etc., outside the home, and it all infuses inside. And part of the power dynamic ends up being the illusion that that in order to be powerful, I should at least find somebody who is powerless compared to me, or make somebody powerless compared to me. And that's part of the internal dynamic that goes on. So that we have external factors as well as internal factors that the COVID-19 makes poignantly clear. Let me stop there for now.
Thank you so much, Dr. Danieli. Dr. Sommer, your work in Brazil directly engages men as a means of domestic violence prevention, which is slightly untraditional. Could you talk a little bit about the goals of your project, how it's been implemented, any early successes, and how it works in relation to many of the challenges that Dr. Danieli mentioned?
Yes, thank you so much. First of all, I'm happy that you're framing the question about my work in Brazil. The work is to be done. We're really at a planning stage. And this is an opportunity to invite people who can give us advice, guidance, support, because the proposal here is to engage men in change. Almost everything that I've seen, maybe that other people have seen, about violence prevention focuses on the victims, the survivors, women. I just saw a recent report in Brazil about responses to domestic violence, and there was a comparative part of it that traced what other countries are doing to respond to a spike in domestic violence. In Brazil, it's about 50% more than it was a year ago. And that's not an outlying statistic. It has, unfortunately, several companion countries with similar statistics. And in almost every case, the response, the official paternalist but loving response of the government is to open up hotel rooms so that they can evacuate women from abusive households. We saw no project that focused on men. And so our impulse is to invent a program or a series of programs that address boredom, the kind of situation that Dr. Danieli was describing. Men who are stuck in their homes, have nothing to do with their energy, and take it out on women and children. Boredom has a high correlation to violence. And so the proposal is to engage men in chat groups that will take a long time because they're involved in games and competitive video games with real football players, soccer players. So the project is called Football Viral Football Gone Viral. And it's a way to address men as partners who would prefer to be better partners, better domestic aides to their children, to their wives. The football games will be interspersed with tips on cooking, on laundry, all done by famous football players. So the last thing I want to say here is that this approach is inspired by very productive histories that we have of people who have dared to address perpetrators as full-fledged human beings who can change. Many of these football players are distressed because some of their friends are reporting to them higher levels of aggressivity, even in themselves. Some men are concerned about this intensification of violence in their homes. And we want to address men not as disposable victimizers, but as partners who would prefer to have peace and pleasure in their homes. So this is a project that we're just developing. We'll write it up and present an IRB, but it's already gotten interest in other countries as a way to expand our range of interventions and not continue to focus on women as people who need to solve their own problems. It's almost like victimizing again the victim. So that's where we are so far. It's part of a general program. Ashri said that our mission in Cultural Agents is to bring arts and humanities back into civic engagement. And this is one of the ways that we want to engage through the productivity of pleasure. Pleasure isn't taken seriously when we do social interventions. And without pleasure, as one of my mentors says, nothing good happens. So I'll end it there.
Thank you so much, Professor Sommer. And that's really interesting. I feel like traditionally and historically, most interventions address potential victims. And so the burden is often on women to be able to protect themselves against violence. And that also sometimes contributes to the rape narrative as well, and how we think about victim blaming as well. So that's really interesting to think about interventions that will address potential perpetrators instead and engage men. So I was just wondering, given your expertise, Dr. Danieli, and then also Ms. Matosian, have you seen something like this, an intervention that addresses men to prevent rape or sexual violence or domestic violence in your experience and expertise?
There has been a movement in the last decade. I can't give you the exact years, but I can look into it and feed it to the group now to engage men actively. And there's been a very active group of men involved in this. It started, I believe, with the last Secretary General. Ban Ki-moon. So I can absolutely put you in touch with that group. If you would be in touch with me, I believe Ash has all of my contacts. And actually, it's a brilliant initiative that you're suggesting, because one of the major culprits here that I did not mention, because I was thinking more of institutions and groups outside, is a culture per se. As a and I view culture in my work as both a healer and as a buffer, but also as a transmitter. And what's brilliant about your idea, which I'm very excited about, is that you're actually using cultural stars, culturally approved star within the culture, to invite them in, to be part of that of their own culture that they normally admire, but they don't put together football with the abuse or their tendency perhaps to abuse. So I'm very excited about that, and that we can find help for.
Yeah, I think that the idea of using role models in this type of way, in a very creative way to engage potential perpetrators, is very exciting and a very novel way of thinking about approaching the problem. So I was just wondering, Ms. Matosian, you've been working and supporting survivors for so long. Have you, in your experience, ever seen an intervention such as this? Has it been effective in your experience? I'd love to hear your thoughts on it too.
Thank you. First of all, I like to continue from Dr. Danieli's remarks that indeed during this quarantine or there's this lockdown, we have the door is closed. I know that if the victim is in close proximity with the perpetrator, it's the most dangerous time for her. So therefore, this situation creates an increased danger. Now, in terms of the data that we have, actually we have less information in the sense that we have to make a distinction here between the developed countries and those countries that are less so or in the process of being developed, because in countries where there is a strong system of support, a developed system of response to domestic violence, and in countries that are developed, we can have information on an increase. And I tell you why: because women here, they have internet, they have smartphones, they can have a possibility to reach out somehow. But for example, in Armenia, that is not the case. And many women, for example, we observed that their cell phones are in the name of the husband or the partner, and they monitor very closely. And they are in such a controlling situation, a lack of privacy, that if at the time, let's say the perpetrator would go out of the house, they would be able to call. But since now everybody is indoors, they are very strongly monitored. And actually, we did not receive an increase, a substantial increase in calls. Secondly, I like to say that indeed the unemployment is a stressor, and anxiety builds out during this time. And with the perpetrator, the work also include besides the boredom, but to distress people, to deal with their anxiety and real fears of getting sick, fears of being, contaminated, fear of not having employment. Those are real issues that the perpetrator also deal with. And I think that minimizing those stressors is also very important. However, in countries that have started recently to address domestic violence, like Armenia, which were very long time in denial of this problem. And I have to say that in the past 10 years, gradually Armenia has moved to more proactive response to domestic violence. In such countries, perpetrator programs are still very early on. And really, we were told by the Council of Europe that a perpetrator program should come into effect once the government has a robust survivor program or a program on addressing the victims. Why? Because the state resources should be put first into protecting the victim. And once that, and once the system is completely developed, that we should also pay attention to the perpetrator program. Unfortunately, Armenia does not have experts into how to deal with perpetrators, first of all, so that we have to build that. And also, being a very patriarchal society, the perpetrator program has to deal, a perpetrator program requires other conditions. Maybe the probation system, where a person is accountable somewhere, because as you know, out of their own goodwill, they will not come to a perpetrator program. Or maybe conditions that, okay, you will have maybe visitation rights for your child if you go to a perpetrator program. In other words, it has to be an incentive for the perpetrator to attend these programs. Otherwise, he will not voluntarily go, especially in a society like Armenia, which is very patriarchal, with a lot of gender stereotypes. You know, the surrounding, even the family of the perpetrator and the friends, you know, will laugh at him if we go to such a program. So these are some of the challenges that we face. And I finish here.
Thank you so much. I think it's incredibly important to investigate the specific cultural context in which organizations are working to understand what the specific nuances survivors or people at risk for violence require. And in the United States, one of the biggest issues we encounter is that survivors are constantly, you know, trapped with their abusers, especially during this period of lockdown. You know, Professor Sommer, Ms. Matosian, and Dr. Danieli, you've all mentioned different challenges that women face. I guess across contexts, what are some creative ways that communities can help address you know, these unique challenges that survivors face during this time? And what would allyship look like, for example, in a context of in Brazil, Armenia, or Israel, for example?
You're asking us?
Yes.
Okay. I cannot overemphasize the words education, awareness, education, awareness, education, awareness. And that is in every possible discipline, on every possible dimension involved. And actually, the family system is one of the most complex systems you can envision within, indeed, the cultural, socio-cultural, political, religious, legal, etc. One of the professions I didn't mention are journalism. I think this is a good time to invite journalists to actively participate in this campaign, because in particular, you know, there are journalists who are particularly educated, what we call in ethical journalism or in trauma. There are several programs I can speak to you about in this or another occasion, and they can really help in raising public awareness, raising awareness of the professions, provide support for the victim survivors via television, via all of the media. Right? In some cultures, you have only radios. In some cultures, you just draw things. In some cultures, you cannot even put things into words. You were talking before about the denial. that still suffuses at least 70% of the world. And I'm being generous, actually. But for example, I'll give you an example. In the Philippines, during the dictatorship, unfortunately, there's another one now. But in the past, one of the ways to express oneself that was not dangerous was to sort of create like theater plays in the streets, in street corners. It was culturally okay. It wasn't experienced as dangerous by either the regime or the people who are doing it. And they could act things. Now today we can't do it in the street, even in cultures, and you could do it in dancing without even verbal, right? So you can do puppet trees or whatever. And I'm sorry to hear that the internet is not yet available in Yerevan, for example, as you mentioned. But we can use the communication resources and good communicators and good messengers, right? To create the kind of culturally less threatening messages, both to victim survivors and to perpetrators and to the children. We're talking primarily about women, but you know, my work is very much multi-generational. And so I always think about past, present, future, not just right here. But we can talk about that separately. But, and of course, another extremely powerful group of influencers in the education awareness part, beyond teachers that are of course extremely important, are the clergy. You were talking about patriarchal society. I'm afraid in many of the patriarchal societies, the clergy usually defends the perpetrator and blames the victim. So we have we have created, there are today groups and organizations of clergy who are being particularly educated not to deny and actually to become part of the healing and the buffering agents in this picture. I hope I'm not being too vague, but or too external, but let's start from here.
Yeah, thank you, Dr. Danieli. I think you brought up a lot of really, really interesting points. I think it's really been important to me and everyone on the task force to think holistically how we can think about this systematic problem and think about all the different actors that we can engage in trying to solve it. And so think about like potential victims, potential perpetrators, and then taking that journey from bystander to ally and what it means to educate yourself on how to safely assist someone that you're worried about has been really important to us. And I think like thinking about clergymen, but then also thinking about doctors and teachers. I think now more
everyone, every profession involved. I think I mentioned to you privately that as president of the International Society for Traumatic Stress Studies, we created curricula for education and training of all professions involved in the saga of victim survivors. And you can follow it yourself very simply. You simply say what happens to the victim before, during, after, and everybody involved should receive specialized educations. And you mentioned doctor, nurses, police, anyone, doormen. You know, after 9/11, we trained bartenders to listen to people downtown. Wow. Okay, when the UN did the education, come on, a major world vaccination by the year 2000. When UNICEF did that, you know, in the developing countries, you know, you can always think about formal leadership and informal leadership. When you spoke about engaging the government, that's formal leadership. Clergy, teachers, formal leadership. But there are also informal leaders, bartenders, hairdressers, the gossip in the village. The best agent to do immunization by the year 2000 was the gossip of the village. Whoops, I'm on low battery, I will put it back. But the gossip of the village, she would just tell everybody. You know, she sits on the stoop and tells everybody. And she was like the best agent of social change.
Yeah, something
so think about those two.
Yeah, no, just to follow up, something that interesting we learned about is in India currently there is an organization that have been meeting women while they're at the river washing clothes, because that's the only time when they're alone, and that is the only time that they can support survivors who are experiencing domestic violence during this time. So it's been really interesting to think about how different communities have thought about leveraging just like common agents or informal leaders, as you mentioned, in order to take on responsibility and to help support survivors during this difficult time. So I was wondering, Professor Sommer and Ms. Matosian, if you in your experience have seen something like this, or what are creative ways in which different communities have tried to support survivors currently?
If I may, I want to give some anecdotal. Last September, I went with the Deputy Minister of Social Affairs to Boston area. And because the mandate of the government is to prevent domestic violence. So she was constantly asking questions, well, exactly how do you prevent domestic violence? What programs do you have to prevent? And in the end, she understood really that, as Professor Dr. Danieli said, it really takes a village. Prevention involves taking a village, because everybody, so for example, if a woman goes to the doctor and the doctor asks, you know, have you been afraid? Have you been, you know, threatened by anybody, any episodes of violence? You know, the doctor immediately can call a social worker and will take it from there. Same in schools, same to the hairdressers. So the more people are involved, that's the prevention. And it takes really in the entire community. And I want to mention also that in response to COVID-19, you know, different countries, as I mentioned, the more educated and the more trained a community is, the faster the response can be. And if we start now to think that how should we respond to this, we are already late. Because the response should come immediate, and it comes immediate in those countries that already have in place a robust program. For example, if I remember correctly from what I read, that in Italy and France, immediately a week after the state of emergency or the sheltering in, they allocated hospital rooms for quarantining victims and then move them to shelter. And these are some of the responses that are immediate that we need to come into place. Or, you know, there are countries that they do have a national hotline number for domestic violence. Those are the ones that they respond better to such to crisis in crisis times. Those countries, they do not have a national hotline. You can imagine how difficult that is. Also, the police force. The police force in these times of crisis become the more than first responders, because they have to act also as quote unquote social workers, where they refer, where they're able to, you know, transportation is not working in Armenia right now, public transportation. So they have to be there to assist at all levels. And if the police force is not properly trained, not properly sensitive, not responsive, that really it's a hindrance. And we had instances when a woman had to walk by foot, you know, miles and miles till she would reach a policeman, a traffic policeman, and the traffic policeman would say, that's not my responsibility. You have to go to the station, and the station is another, I don't know how many miles away. So if we're not sensitive and we're not aware of these issues in countries that are not really prepared, obviously the response for this is not appropriate.
I want to link Ashri's question with one of the first things that Dr. Danieli said. Ashri asked about creative responses, and Dr. Danieli began by saying we need good journalists, communicators, and then you slid right into art making, into theater, into storytelling. And that's where I think we have opportunities that we're not exploiting. When you and Ms. Matosian say that we need a whole village, this is a kind of prompt that I would like to just refer to in Bogota, Colombia, where a mayor in 1995, his name is Mocus, inherited the worst city in the Americas, and the way he actually healed a city that was corrupt and violent was to produce collective public art projects. The first thing he did, instead of going after drug traffickers, was go after traffic abuses that ended up killing a lot of people on the street. So when nobody came up with a good idea about how to do that, and his Secretary of Culture said, nothing to be done, boss, it's time to bring out the clowns, Moku said, let's try that. And he brought out 20 pantomime artists who replaced 20 cops, and everyone started laughing. The kind of peer pressure against the perpetrator programs that make them not work was the kind of peer pressure that made people take good note of the mimes, because if you crossed on a red light, the mimes would make fun of you, and then you were the laughing stock because you weren't following the law. And after a couple of years of that, people started following the law second nature. The rate of traffic deaths went down by 50% in the first year and up to 60% by the second year. And then he went after the drug traffickers. Homicide went down. He had a campaign called Vaccine Against Violence, and it was precisely a program against domestic violence, because you know that violence has been treated in epidemiology terms. How do you have a vaccine then? Because Mokus knows how to make a joke against. And he created, again, a public event. I can tell you more about it. I don't want to take more time. Where people felt either relieved that they took the vaccine, or they didn't, and they were identified as people who needed more help, more psychoanalytic help. But I think in response to your question and to the tendency that I felt in that first answer, we're not taking public arts seriously enough. And this is why we're going to experiment with football gone viral, with games, with the pleasure of sociability. We cannot afford to underestimate the value of pleasure as a deterrent to aggression. Some of you might know much more about psychoanalysis than I, but those of us who track aggression know that it's a supplement, a replacement for pleasure many times. So let's let's think together about programs for perpetrators that don't invite them because they're obliged, but because they want to go, because they're discussion groups about their favorite football team, because whatever. And they know that they're going because they want to live better at home, but they get to talk about something that's fun. And they have to show the recipe that they used this week when it was their turn to cook as part of the activity. The humanities used to be a way to get out of the cloister and intervene in the world. And I think we have enormous opportunities to bring arts and interpretation back to do that kind of civic work. I'll stop.
Dr. Sommer, if I may say, coming from the nonprofit sector, international donor organizations now put a lot of accent into creative waves of communication. And, we are challenged to think about theater, mime, whatever it is. And but sometimes, unfortunately, at the NGO sector, we don't have really those resources, or we're not that much into that art world. But we have to think outside of the box. You're right. And but international organizations, what I'm trying to say is that they recognize the value of that, and they recognize that in societies where, as Professor Danieli said, maybe writing is, people don't read that much, or maybe they are not, they don't have access to the internet or things like that, information. That's very important to find means of communication that brings them into their homes or into their communities. And I just want to point out that there is a tendency towards that nowadays. It would be good to have it maybe at state level rather than not only at NGOs sector level, because it's what we do, it's really a drop in the ocean, and it has to be much more, or like those traveling circuses or something. Yeah.
Thank you. I do think, as all of you guys mentioned, that this idea of kind of taking a village to prevent this issue and using local programs is essential. So Dr. Danieli, I'm curious to see what you think about the role of multinational organizations like the ICC, WHO, and the UN play in combating domestic violence across the globe.
And women and violence against women, they are involved already, actually, and they've been reporting from some developing countries as well. That would be of interest to you. I keep forwarding Ashrita all of the findings I have collecting from everywhere, and hopefully they're creating a wonderful platform of the world with, right? Ashri, maybe you want to say something about that, to cover that. But let me say 3 things before, so I don't forget them. With regard to the government and the arts, that is again a cultural challenge. How many governments really promote the arts? So while they have the funding, we might have to do the pushing. I'll explain why. Let me just clear cut tell you that all international law instruments on behalf of victims' rights and victims' care, I had the honor of participating in creating all of them, actually. All of them started with NGOs. Then they were always controversial with governments, and they sort of remain that way. So while you're talking a little bit of an ideal world when you say, government should be the main actor, I think we should be very realistic and keep working to advocate that they do. and to teach them how important it is. As you hear, a mayor took the initiative, so it's not unusual. And there are countries that are very proud of their culture and want to use their culture for good. But there are countries who don't even consider culture of importance. I mean, I'm ashamed to say, we are afraid of deprivation of funding in the United States for the arts now. And this is a very, quote, progressive country. But you're also reminding me, after 9/11, my dream was immediately to reach out to artists, because I'm very involved in the arts. So it was very natural for me. And I thought it would help the artist be less egocentric and play more of a healing role in society, and less just me, but give to the society. So my dream was to create vases of the ashes from 9/11, and that every artist will adapt one family and create the vase with that family. I was told immediately by the Red Cross that it was a logistical nightmare. And I got, but I did get every family to get a vase with ashes. But the artists were not involved that way. But they were involved in other ways, like special concerts or special free theater for survivors, families, free camping, etc., etc. So this is just, I think in some ways we are talking part in terms of the process of achieving something, and another part is the substance of what we want to achieve. I'm sorry, I'm meandering. But been trying to, and I think I know that mayor, a brilliant man, brilliant man. But how many creative people go to politics? So let me stop there. I'm talking too much. So sorry.
I want to respond to your rhetorical question. How many creative people go to politics? I think that if we, as a collective, took arts as seriously as you do personally, we could help push the agenda. If there is funding, if there are creative people who have to contain themselves when they get into important positions because they think that makes them look more serious, we could help break some ice with initiatives. As you say, both of you have said that it's through the NGOs that we get a budge. If we collectively acknowledge part of that budge towards the arts, participatory arts, as a way to empower women and to engage men in good development, I think we would be doing our civic work together, because many of us continue to enjoy the arts, but not to take them seriously as game changers. And I think that what we're considering here with Antanas Mokus, with several artists. I don't know if you know the current Prime Minister of Albania, Edi Rama. He is a painter. He turned the country around, painting.
He's a comedian.
And yeah, well, no, the comedian I think was the Icelandic one. But there are leaders who know that. What is the definition of art if you ask a humanist? Art is what makes you stop and reconsider because you don't really understand the message yet. It's not about clear messaging, it's about clever, difficult messaging. So an artist is a game changer by definition, if we take it seriously.
May I add here, and that I omitted to answer your question before, I'll put it together. The United Nations is and its programs has been extremely successful in engaging artists, actors, uh, uh, and others, even, and also sports figures in their good causes. So UNICEF has goodwill ambassadors. Women, UN Women have goodwill ambassadors. Angelina Jolie has been an amazing goodwill ambassador, both for refugees and for violence against women. Very active. And I'm sure that, again, the issue there is access. It's how do you get to them? But when you get to them, I'm sure it won't be difficult to recruit them.
Yeah, definitely. I think it's really interesting the point that you all brought up about how art can be used, especially in addressing these issues such as domestic violence, like thinking about using art in the response and healing process for survivors, but also something that Professor Sommer brought up is how art can be used in the prevention side of things too. And so that's a really interesting thing to think about, because also in my work in Kenya, and the Yael's joined in this, we use role playing for bystander intervention tactics, and that helps a lot of the students think about how they can go from bystander to an ally and think about how they would directly engage safely to support someone who is like being attacked. And so that's been a really interesting and important part of our work. So it's really interesting to think about how art can be used on the prevention side for allies and then also for potential perpetrators. So I was just wondering if anyone wants to add anything out. I know we've been going for a while, so I don't want to take up too much of your time, but I was wondering, Ms. Matosian, if you've seen art being used in your experience in this way.
Yes, we had several programs with in Armenia with the Coalition to Stop Violence Against Women through theater and especially in squares, in public squares. We had formal theater too, but usually public squares that draw a lot of attention. And also we do a lot of actions, what it's called various commemorative dates that we have for remembering the survivors, remembering the victims. And during that time, it attracts a lot of the public, and we distribute brochures and all sorts of things. And you know, the actions that throughout the world have been were shoes of women, of indicating the women that were killed or their clothes, and also involving prominent figures in society. Of course, it's more effective if you have an international figure as Angelina Jolie, but even at the local level, prominent figures that they speak out and they come out about this issue, it's also something very important. Programs on TV, interviews, all sorts of, many of our victims, they get their hotline number, our hotline number, from the morning shows, when a lot of the women watch those morning shows while the husbands are out of the house, and they get the information. So it's an ongoing process, and I agree that we have to work at all levels. You know, some individuals are more, some societies are more prone or much more involved. When we talk about art, I'm not talking about the formal art. I'm talking about, you know, artistic ways or creative ways, let's put it this way, creative ways of addressing a vast population. And we have to be very sensitive. The rural communities are very much different from the more sophisticated, more emancipated urban communities, and we have to adapt constantly to the to what might look bizarre in a rural community would be very interesting for a urban community. So it's a constant process of adaptation and integrating the values that there are in those communities, because in the end, the idea is to put the message across. And many times I've noticed that organizations that deal with domestic violence, they're very theoretical. They throw out a lot of information that we in the field understand it. But you know, for example, gender-based violence. You know, many people don't understand what that is. You know, and so we have to use the language. We have to use the techniques and means that to be able to communicate, to transfer that information to the public.
Thank you so much. I agree with you completely, and I think it's incredibly important what you said about identifying the values within a specific community and identifying how those values can be translated and incorporated into different solutions. So thank you so much for sharing those anecdotes, that evidence with us. So I think we're just about at time. A really, really productive conversation, and it's been incredibly helpful to all of us to understand and contextualize all the different facets that go into addressing domestic violence during this incredibly difficult time across the world. I want to take a moment to thank our three wonderful panelists for joining us today and providing their expertise and their experience to us. I know I can speak on behalf of the entire COVID-19 task force on domestic violence when I say that it's been an absolute pleasure, and we've definitely gained a lot of insights into like I said, the ways how nuanced this issue is and how we as an organization can go forward, get more people involved, and address the right concerns. We've talked a little bit about how it really does take a village to develop an effective solution. It requires the engagement of stakeholders all the way from the arts to the UN organizations educating and providing information on this topic. It requires governments being at the forefront of making a priority themselves, so then organizations can take on those issues as well. And I really thank you all for providing us those points. So thank you again. For our viewers who have tuned in, I just want to say thank you as well. Looking beyond just this seminar series, like I mentioned at the beginning, we definitely love if you'd like to get involved. Like I said, you can follow us on Instagram at COVID-19_taskforcedv, our Facebook page at StopDVCovid-19, or our website www.covid19taskforcedv.org. And we hope you stay engaged in our conversation. Like we mentioned, this is an incredibly important issue, and the more support we have, the better. And please, stay tuned and join us next week for our next episode on the seminar series. Thank you again.